So I got to tell you, a lot of times we're in the middle of the night, I feel this on my arm. And it's my wife, and she's trying to push me over, so I'm not on my back. I'm not on my back, I'm on my side. Go ahead, take a wild guess.
You probably snore, Randy.
Give that man a turkey for the right answer. Yeah, I do. And, so we're here to talk about how does dentistry, how can that cure that? Or what can you do?
So I hope my buddies are watching this. They bust my chops all the time. Snoring, you're going to take care of snoring. You know you're not a real doctor. You're only a dentist.
Oh, you get that,
huh? Good one. So remember, when you have that toothache and your face is swollen out to here.
You're right. I'm not a real doctor. I can't help you.
Yeah. Okay. So you're not going to get your physician to pull a tooth. But anyway, the snoring in a dental practice, and particularly ours, is taken care of with a snoring appliance. Okay. And there's different types of snoring appliances, so I don't want to get too much into the detail of what it is, but it's usually an upper retainer and a lower retainer that repositions the lower jaw, very similar to, if you remember, CPR. Jaw down and forward, opens up the airway, reduces the amount of tongue that's blocking the airway, or the reed-like action of your soft palate and uvula. Okay? Most of the time, we're seeing it with particularly men, 20 pounds overweight, 50 plus years old. It used to be a neck size of 16 or 16 and a half. Now it's down to 15 and a half. Because what we're finding is we get older, we lose the muscle tone in our body. It's going to happen.
I always feel it just feels like laziness when I do it because
it's just you're in a position where like you just like you're chilling back.
Yeah, right. I know.
And you wake up with a sore throat, maybe.
Sometimes
it's dry.
Yeah.
So, what the appliance does just moves the jaw forward. So there's different kinds. The number one way to take care of snoring is with a CPAP, BiPAP, whatever your physician, your ears, nose, throat, your respiratory specialty people are recommending for you. But when I say a problem, not a problem, it's a problem for the patient if they're claustrophobic or they just can't stand the noise. Now they're making quieter machines for the CPAP, which is basically a nose piece that
looks like the jet fighter.
It's just blowing room air up your nose, so you are fully oxygenated, if you will. All right. You can't wear it because you're claustrophobic. Come see Dr. Bilski. We take molds. A lot of times, what we can do now, you don't have to use the putty, the clay. We use a camera. We scan your mouth and we make your models that way, and we send it up to the laboratory. Sometimes it takes a little longer, about 2 to 3 weeks, usually 3 weeks to make these appliances. We fit you, we have you in for a couple appointments. And then there's a huge reduction. It really is what we call patient compliance. That means like, Randy, you gotta wear this or it's not gonna work. Well, there's a lot of patients that have been diagnosed with sleep apnea, and there's mild, moderate, and severe. Moderate is kind of tough to handle in the dental practice with a appliance, but if you've been wearing a CPAP or cannot wear CPAP because it bothers you, then you're not going to wear that. You got to do something. So we're kind of like, it's what you want. What's your goal?
Yeah.
What are we trying to achieve here? A lot of men, after they retire, they lose that tonicity, and that's what you hear a lot of people. He just retired, never should have retired. Now he passed. Well, he had sleep apnea issues that created other issues that created blood pressure problems and not sleeping and immune system. But it's not just men; it's women. It's kind of like the opposite. Women that are with longer necks and lean, with a high vaulted palate, they snore too. So it really is your sleep partner, whoever that is. Now, we know there are a lot of people out there that are single and solo. They don't have sleep partners.
Okay.
Now you have to base that on symptoms with your physician. And then your physician says, well, it looks like you have sleep apnea. Let's do a sleep study. You go to the sleep study, they're like, oh, you're moderate, or no, you're mild. So moderate and severe, we're gonna do CPAP. Mild, you should probably consider it, but maybe your dentist can help you. So we make snore appliances.
Well, it's again, we always learn something new here. And, if you cut logs at night, do some log sawing, well, maybe you should talk to your dentist. And if your dentist talk to Dr. Bilski, he can take care of it.
They have recorded and contrast the decibels
Who wins?
of snoring.
Yeah.
In some cases, the snorer is at the same decibel reading as a lawnmower.
You know what? I'm not sure where I am, although my wife did tape me. She did tape me one night just to prove I was doing it. I was like,
It's embarrassing, but I do. I snore.
Yeah.
I have an appliance.
Even the best guys, So hey, again, this was an unexpected subject. It really was. But man, glad we had a chance because my mind is just getting more and more expanded.
So it's good to have you as the interviewer because I got to tell you. He doesn't know anything about teeth.
I know nothing.
Fabulous. And he says he's tremendously stupid. I said, no, I have to agree with you on that. No, it's not. It's about teeth. So, but you're getting legitimately a non-dental person perspective and question.
Yeah, honestly,
and
I know less than any of you do. I'll tell you right now. So this is why it's fun for me. And if you're watching, it's got to be a little fun for you too. Hey, and remember, you can see more of these at the website.
Yep.
At Bilski Dentist. I'm sorry, Bilski. You are the dentist, but your practice is
BilskiDental.com is where you want to go.
Okay, that's much better.
That's why I love the guy.